Hi, Dr. Thayer here. I'm with Pouya. This is our seventh treatment we're going to do on him. This is Friday. He's already had it this morning. He's doing remarkably well. He's the patient who has had periods of pain for years and paresthesias and all these things going on. He had a day off yesterday, didn't come in and see me. Went to Laguna, hung out in Laguna, right?
Fashion
Island. No, not Fashion Island. Fashion Island. Hung out all day and felt pretty good. So I'm going to turn it over to him, let him tell you how he's doing. If he misses anything, we'll just kind of pick it up. Pouya, how are you doing overall?
I'm doing much better. The most important difficulty that I had was the paresthesia that took my attention away from and didn't let me focus. Now it's much better. It's much more limited. I only feel it sporadically around my jawline. And
9 years of this paresthesia, right?
Yeah.
And how long has it been since we started treating you? 1 week.
1 week, yeah.
And you already started feeling better. Less than a week, I know. 5 days.
Yeah.
So tell us, you had paresthesias all over your body. How is it all over your body right now?
Right now, I feel more relaxed in my trunk and my shoulders, and it's just, I don't know, it's just on my beard.
He has a little bit of paresthesia in his beard, and he had a little on top of his head the other day.
Yeah.
But the whole body that you had before is almost all gone.
Yeah, it turns into that relaxation.
Perfect. Neck pain?
Neck pain? No, I don't have.
Low back pain?
Lower back pain? No.
Headaches every day?
No, no headache.
When's the last time you had a headache? You had it every day before?
After the second, third day, I think it went away totally.
Gotcha. Breathing?
Oh, breathing is like I'm fresh out of a swimming pool. Like I feel that.
He keeps saying swimming pool.
Like,
I don't know
yeah,
what that means,
it made me feel like this. Whenever I came out of swimming pool, I felt like I can't breathe.
Yeah, I've never heard this before, but he must be a rain thing or something. Because I've never heard this.
It should be only for me because I never heard it from anybody.
I've never heard that before either.
I don't know.
You get out of the pool, you feel better, you breathe better out of the pool.
Yeah, I breathe better.
I don't get that.
I work my respiratory system maybe. I don't know.
I don't know, but he keeps saying it, and I'm just going to go with it. Anxiety, depression. How's our anxiety been this week?
Oh, I didn't have anxiety. No anxiety.
Is that unusual to have a week where you don't have anxiety, or does it feel something different?
It's definitely unusual because the feeling that I feel, the relaxation, is unusual.
Gotcha.
So.
Sweating. Sweating.
I feel like I'm able to sweat, especially in my head and my face.
Is that unusual? Did you not have the ability to sweat on your face and your head before?
Yeah, my face and my skin was dry, and I couldn't sweat. And whenever I wanted to sweat, I felt a rush of paresthesia.
Gotcha. And so you're sweating now, which is something you want to do.
Yeah.
Vision.
Vision, after the first day, I noticed some improvement, but after that, it's been the same.
Same good or same bad?
It's not totally clear,
yeah.
but yeah.
Better than before, but not perfectly clear.
Yeah.
Perfect. I love that. How about the hearing?
The hearing is balanced, but whenever I try to blow air in my nose, I feel some air is still stuck in my ears, but I don't feel it when I'm breathing. Because before, whenever I was breathing, I felt my ear pressure goes up and down.
So this morning you told me about constipation. Tell us about that.
Yeah, the constipation.
Because on Wednesday he said it was better, but he didn't want to say anything. Why?
Because it was, I guess, the first day that it improved, so I wanted to make sure everything's...
And you were a 2 to 3 times a week go to the bathroom guy. Now what are you?
Yeah, it's like twice a day.
Twice a day?
Yeah.
So goes from can't go to going, and he even called it. I didn't even ask him. This morning he goes like this, he goes, By the way, exactly, by the way. On Wednesday, I thought it was better, but I wanted to make sure, so I didn't say anything. And this morning, you brought that up. So, really good stuff. How about sleep? Sleep was off before. Are you getting back? We haven't talked about that.
I think my sleeping habits were off, so I cannot say it's...
I forgot about asking you this. I go to bed at midnight, wake up at 8. How's that been for you?
Yeah, and I didn't intentionally bring it up because...
It didn't work.
No, because I didn't do the 12 to 8 so far, that well. I messed it up. Yeah. So I'm gonna get started.
You know something? This guy says he respects his elders, but I don't think he does. I think it's like he says it, but he doesn't actually mean it.
I do my best.
Exactly. Well, that's fair enough. At least that's the most honest thing you've said. Anyways, we're talking about circadian rhythm, and circadian rhythm is the idea that your pituitary gland secretes a certain hormone that allows you to get on sleep schedule. And when you screw it up, like with jet lag, you have trouble sleeping. So I'm trying to, and this is 2 days ago, teach him how to do circadian rhythm, but again, didn't listen. So anyways, well, I'm sure we'll work on it this weekend.
Yeah,
this
weekend.
That's right. Good. Anything else going on? Heartburn, we have that once a week. There's no big deal. How about your jaw pain? All this jaw pain on the left side.
Yeah, I don't feel tension specifically here, but I don't know. There's a deep sometimes pain that comes in the left side of my throat and sometimes in my right ear, but it's not persistent and it's not bothersome.
Left hand numb?
No, it feels the same.
Feels the same. Yeah. Anything else you want to add?
What do I want to add? No, nothing on top of my mind.
Good. So we've already given you exercise to have better posture, right? You're working on better posture. Things have changed since then. We're going to show you. We're going to show the treatment right now. What have we treated on you all week? What area have I touched on your body?
Neck.
Have I touched any other part?
No.
Have I touched your arms, your hands, your throat, your head, your legs, your back? Anything else besides just your neck, right?
Yeah.
Okay. So we have global issues, and I've only touched your neck, right? Okay. So everybody on there always asks me, "What are you doing offline? You must be hiding something." Does it seem like?
No, I felt like that myself before also. Like there might be some other adjustment. I only see the neck maybe, but it's been only.
So a good question here is this: what you see on the camera when you watch these videos, is it what's going on in here?
That's the only thing.
And Dr. Thayer's kind of boring, actually. The best part, this is his funnest part, is on the camera. Everything else is boring as shit. No, but there's nothing else besides what's on camera, right?
No,
yeah, exactly.
Yeah.
So everybody always thinks there's some kind of magical thing that I'm doing that I'm hiding from the. No, what it is you get a real adjustment, you get real balance, and real balance does this stuff. So I'm glad you're feeling better. This is midterm on his 2-week plan, so I wanted to get kind of a progress report where we're at. 7th visit. Let's get you treated. On your back, please.
Okay.
And you go all the way around this side. Now come up here a little more this time. Come up top, yeah. There you go. Oh, much better. So right now we're still adjusting mid to upper neck. We're at C2, C3 the first couple days. Now we're C2, C3. Next week we're going to start Atlas adjusting. He's doing pretty good. We need to go over other issues with him, but postures he's working on. Was your neck sore after this last one? With your keeping your chin up?
Right after the adjustment?
No, this morning. Yeah.
Oh, this morning? No, my neck doesn't have any.
Well, because you were sore after when I taught you on Wednesday. Instead of you left, you were a little sore, but not this time. Yeah.
No, definitely.
So actually, I'm going to go lower on you today. Good, nice. Okay, that was a little lower adjustment. You feel the difference?
Yeah, I feel it in my traps right now.
And I haven't done that one. I've been doing here and up. That was a little lower. This side. Up here a little more. Good. Good, nice. So what do you think of that so far, Pouya?
It felt kind of similar.
Okay, so that was still lower. Just give everybody kind of a taste of how things have changed the week with your neck adjustment. Has it changed? Does it feel the same? What do people that want to know online, how does this experience happen? How does it change throughout the week?
Throughout the week.
Or is it the same? I mean, you can just, whatever you feel.
Like after the first adjustment, I had a rush of something like I felt so cold and
that's right.
Lots of reaction from my body, and after that, every day things got better. Something got better, like whether it was my hip pain, back pain, suddenly like going away, my back of my eye pain.
Every day, kind of something different. Every day, something else gets
keeps
better.
getting relaxed,
Good.
like
Right on.
to my head.
And so you
It's
think
going up.
the first day you think, oh, what a great result, but it still continues to get better. Huh?
Yeah.
Good, I love it. Okay, so that's where we're at right now. I'm going to get some more visits on this camera next week, but that's midterm for him. And by the end of next week, he'll be even doing better. So thanks for watching so far. Hi, Dr. Thayer here. I'm with Pouya. This is his last visit. He's been here 2 solid weeks. Done pretty good, not as good as we thought. We'd like to have him do better, but lots of great success. I'm going to let him kind of take over and tell you where he's at, and then we'll let you guys watch the adjustment. So Pouya, you came with a ton of symptoms. Why don't you tell them what's going on and we'll fill in the gaps here.
Yeah, I was feeling very tense all over my body, especially my back and lower back. And yeah, once we started, first I felt freedom in my upper back, around my back of my neck. And then my breathing got better. My paresthesia got less and less intense. I feel more room now in my body to breathe and actually stay calm. And what were the big things? Oh yeah, anxiety. No, because anxiety was, I think, related to my breathing, majority of it. And once breathing got good, so many things fell into place.
Gotcha.
So,
and how the breathing improved? We just did this on Wednesday. What did I do what did I tell you to do at night?
Oh yeah, recently I was freaking out because I couldn't get to sleep, and once we did the sinus treatment, you told me I could go to sleep right away for the past 2 nights, and I actually had a dream first night, so it told me that it was a deep sleep.
Good.
I feel refreshed.
So not everybody's a straight line here. We have to constantly work on things to make things right, and it took us a week and a half to figure out what to do to help him sleep. Headaches, how are your headaches?
I don't have headaches, no. Especially after...
You had them every day before.
Yeah, it was kind of always there.
So the last couple of weeks, where you been?
Last couple of weeks, first the pain around my ear disappeared, like especially left eye had, and then after the sinus treatment, around my eyes I feel much better. Even I can breathe even better after that.
Okay, so how about the constipation?
Constipation, I got rid of it in the first 3 days. Like
Gotcha.
After that, it was just good all the time.
How about the sweating?
Sweating
Sweating like a pig now.
It's kind of, I can sweat now, I definitely know, because sometimes when you're giving me pain here, I feel that I get sweaty. I feel sweat, but in terms of running outside, still I feel paresthesia in my arms in specific areas, but I know if I push through it, I have, my sweating is gonna go, like I can have sweat.
Gotcha. Vision and hearing.
Yeah, vision after the first treatment, first adjustment got better. After that, it's the same. It's better.
But hasn't gotten any better after that. How about the hearing?
Hearing is pretty balanced on both sides.
And it was off before, right?
Yeah.
Okay. Anything else you want to say? Left arm, numbness.
Yeah, my arms feel pretty even.
Pretty even.
Yeah.
And then breathing was better. Anything else you want to add?
Oh, I had the lower back pain, so it faded gradually over the adjustments. Like it went away small by small.
Let them know on a scale of 1 to 10 or percentage-wise how much better you are after 2 weeks of care here.
1 to 10.
Or 70%, 2%, or 20%, 2, 3. What? I mean, just give us an idea how much better you are here.
I feel like over 60, so I can say 65.
Okay, 65?
65%.
Gotcha. Well worth coming down here, or you wasted your money coming here?
No, I knew it's going to be well worth. That's why.
Good. So, anything else you learned here that you didn't know before?
Yeah, like posture, like actually when my posture you corrected it, yeah, I felt better. my thinking got more straight.
Good. So, pretty good experience, right?
Yeah.
Good. Let's get you adjusted. If you think of anything else, we're gonna get you adjusted, and then we'll be done. Okay?
Yeah.
Perfect. Okay. So have a seat right over here. Good. Okay. Sorry, we don't have a lot of videos in between his treatment since the beginning, but we have been really busy, haven't we, Pouya?
Yeah.
This office has been crazy the last couple of weeks. So we had to get this one in. We don't even have time for this video right now. Look, she's saying no. But we wanted to make sure we got a bookends to your treatment here, so at least people know where you're at after all this time. Good. Good. Okay, let's go this way. Good. Remember the first time you did that? You jumped off the table, jumped out of the chair.
Chair, yeah. The chair was intense.
There you go. Good, nice. Table, sir. Good. Good. Breathe. Out. Good, nice. Shake the other side. Good. Okay, those are both Atlas adjustments, guys. I'm gonna have you come back this one more time over here. We've been working on his TMJ, guys, because he had originally a this paresthesis came from when he had his wisdom teeth pulled. So we're starting to work on his jaw too. He loves this treatment. I'll let you guys watch.
What do you mean by love?
I mean, I was being facetious.
Okay.
Now, don't cry on camera, okay? Your whole family's gonna see this in Iran.
I'm not gonna show them.
YouTube's international. Or do they block these over there? No crying. Okay, slow deep breath in the nose. One more. Good. Okay. Okay, what we're doing, guys, we're working on these muscles in the jaw here, right around the TMJ. By putting pressure on them, we're trying to relax the jaw, taking pressure off the upper part of the neck. One more breath, one more breath. Good. Tell the camera how much you love that.
I hate it.
Good stuff. Okay. Okay. Let's have him walk in the hall in a second.
Okay.
Yeah. Good. Okay, watch his first video and see his posture versus this one. I'm gonna stop right here. Okay, so thank you very much for doing the videos. You've done pretty good so far. Wish we had more time with you. You're always welcome to come back. We've given him instructions on how to find a chiropractor up north. You know, you can't always replace exactly what I do, but we still encourage you to try to find somebody local in your local market. Always again welcome to come back. Thanks again.
Thank you.
You're welcome.
Thank you so much.
See you guys.